Hi, thanks for your interest in our paper. I'm going to go through a few slides that will explain an overview of the paper and the ideas behind it. You'll find more information in the paper itself, and of course you can always contact us by email if you have any other questions. Now let's go to the slides.
This paper is about how to improve workflow, especially in the context of introduction of technology such as EMR. As you know, workflow is often cited as the number one pain point by providers when they try to introduce technology such as EMR, and therefore successful implementation requires not just the technical part, but also culture and work process change. Here's an example of a workflow in which a patient arrives at the office, checks in at the desk, sits in the waiting room, gets to the exam room, gets taken care of, and gets discharged. This is an overall workflow for the flow through the whole office, which is important to examine, but one also needs to examine the individual workflows at each of these points. Why should one do this? Well, there are always opportunities to improve workflow, and often workflow has been stagnant and has never been examined. So it's an important opportunity to examine and improve workflows because there are various factors that need to be addressed, such as the ones listed here. One can also expect to obtain certain benefits from workflow design, some of which are listed here. Importantly, the ability to achieve consistency and reliability are critical. One needs to examine the workflow at each point in the office and to recognize that, in addition, that your patient will transition in and out of your office, and that's another opportunity to examine workflow. One needs to examine and re-examine workflow constantly over time and needs to include every member of the team in this process. How is this done? Well, one has to understand each of the steps in the system, or each of the steps in the workflow. We call these activities, and for each activity one needs to understand what precedes it, what follows it, and what can occur simultaneously. And if one understands this, one can design a workflow, and one can draw it out using various kinds of icons like these, or you can use software that's readily available. The problem is that these are difficult to use, and often these diagrams are hard to understand. So we designed in this study a simpler method that involves simple and easy to read icons, and I'll demonstrate this using a magnetic board in a moment. But essentially, these are magnets that are placed on a board and can be moved around to design and redesign a workflow as many times as you want, engaging all members of the team using this toolkit that contains various elements. And here's an example of an experience from a practice that found not only were they able to improve their workflow, but they were able to help every member of their team understand their own role within the greater system. So here's an example of a workflow that's set up using the board with the magnets, and this is an overview of the patient's flow through the office for their whole visit. It starts with the patient being registered by the reception person. Then they get put in a room. At the time that they're put in the room, if the medical assistant identifies that the patient had some lab tests that we need the results of, or if the patient has been to the emergency room, then they need to gather some data about one of those things. So they initiate some data gathering that may be done by someone else. And then the patient gets to be seen by the doctor, and then there are other steps that would happen over here, like such as discharging the patient, etc., getting their shots or whatever they need to be done. Let's suppose that we want to change the workflow. So we decide that this data gathering is really inefficient to occur at the time when the patient arrives. We want to do something called previsit planning. So we will just take this off. We'll move these over to give ourselves some space. And we'll put a pen here so we can revise our stuff a little bit. We'll move these out for the time being. We'll say, let's do some pre-visit planning. So let's put the nurse in here. And the nurse is going to identify, before the patient arrives, the nurse is going to identify what the needs are in terms of data gathering. They're going to initiate that data gathering, such as getting results. And also they may even do other things as well, of course, such as insert reminders into the chart about what lab test the patient needs or whatever. So that can be represented on here as well. And then, so let's suppose all of that happens before the patient's visit, so we'll move it here. And then we have the patient's arrival represented here. And we can recreate this now and show the new workflow. All right? So then we can do anything like that we want. This helps everybody to keep track of what changes we're making and why. We can take pictures of the board, etc. Thanks again, and if you have any questions, please feel free to email us. Thank you. Bye.